This is Mabel Scott, your Rockingham County Public Information Officer. We have a special COVID-19 update. It's a special news alert with our Interim Public Health Director, Susan Young. Susan, why did we need to do this special alert?
So, Mabel, we have had 2 deaths that have occurred within our county this week from complications from COVID-19, and our prayers go out to these families that have lost their loved ones this week, and we just want to reiterate some points that we have made in the past, but I feel like the time now is to talk about this again to make sure it's in the forefront of everybody's mind. Now, these people did have underlying health conditions, and our case count right now stands at 347 cases that have occurred here in Rockingham County. We currently have 8 people that are hospitalized. 7 of these are new hospitalizations that have occurred since Friday, July the 10th. And this seems to be going up at a rate that is concerning to me. So I wanted to make everyone aware of these statistics and things that we can do to maybe prevent this from going any further. We are seeing increasing number of cases daily. In the beginning, we were seeing 5 cases a day, 6 cases a day. Now we are seeing up to 14 or 15 cases in one day, and that is a trend that we do not want to continue here in Rockingham County. So the disposition of our cases has also been interesting that we are finding. We are able to take some data and find out what is causing these cases and how people are catching the virus. So 29% of the cases currently have been caught from family gatherings, from people going out with extended family members and having 4th of July gatherings or picnics or cookouts or pool parties or things like that, and that is causing the cases to rise. 2% of our cases right now have occurred that we think from religious services or religious events. 12% are from social gatherings with friends or neighbors. 18%, we have no idea where those cases are occurring from. So we still have some what we call community transmission that we can't pinpoint the exact cause of what's causing the COVID-19 for these cases. 8% have come from vacation trips, and they have been varied. They have been beach trips, they have been mountain trips, they have been trips out of state. They have been trips to Florida, Georgia, so it's no one set point, but a lot of those have occurred from people going on vacation. And 32% are still work-related, and we know everyone has to go to work, everyone has to do that. But we are really working with our businesses here and giving them information and trying to make those workplaces as safe as possible. And we have also worked with our Chamber of Commerce. We've worked with our people here within the county that are associated with businesses, and we have done many things to help protect businesses. We also have had our environmental health specialists go out and talk to restaurants. If we do have a positive case in a restaurant, we do get our environmental health specialists to visit there and make sure things are being cleaned properly. People are wearing masks, people are social distancing. We are trying to implement anything we can to reduce the cases that are occurring here in Rockingham County. And I just want to talk a little bit about our data on our website. Data errors may occur on our website due to many factors. We may receive a positive lab result, but then we can't reach the person to say if they're symptomatic or they're hospitalized. So one certain little piece of the data may be missing, which may make the percentage of the numbers when you add them up not always be correct. Or the age may have been left off, or something may have been entered incorrectly. A lot of this information is still being entered manually by people from the hospital and different people, so there's always a chance of human error. And do know there's a disclaimer on our website about our information that it may not always be 100% accurate. And our percentage of positive cases to the number tested, we have only this week received a report from the state to have all of the tests that are completed in Rockingham County to have that data congregated, so we know exactly from every person who's testing in Rockingham County, we know that total number that are being tested, and we have updated that on our informatics page to make everyone understand the percentage positive to the number of tests. And we are very happy to say that we are now have already completed over 6,000 tests here within Rockingham County. Lastly, we are working extremely hard to keep our citizens safe at their workplaces, restaurants, public places, but now it comes to your part. Every citizen has their own responsibility to do their part to keep themselves and their families safe. You have to wear the mask. The mask protects other people, but it also protects you from catching the COVID-19. Social distance, stay that 6 feet apart. That will be most beneficial to prevent the spread of COVID-19. Wash your hands. And only have close contact with your household family members. Those are members that you see every day who live inside your household. Please limit your close contact to just those people who live within your home. These are things that you can do. I am really concerned about some of the trends that we're seeing in our data, and I really have been so pleased of how our county has been doing up to this point. So I want that to continue, and I want everybody to take responsibility to help me and everyone here who's working very hard to protect you in this fight against COVID-19. Thank you and have a blessed day.
And we appreciate you, Susan. Thank you for taking time to give us this alert and giving us this update with details. And we also want to thank you and the whole team with Public Health and Human Services, our health professionals throughout the county, the essential workers. We want to say a special prayer to the families that have been affected, and a special prayer for those in the hospitals. Again, this is Rockingham County. You're in a good place because we care for each other.